When the clock strikes midnight, COVID-19 health orders will be lifted here in Ohio. Most notably, that will soon be history, is the state's mask mandate.
But there is a reminder tonight that the risk of COVID-19 is not going away at midnight as well, especially for our friends and family members who are immunocompromised.
What we're seeing with immunocompromised patients is that they're not always protected by the vaccine.
News 5's Emily Hamilton spoke to some of those who are immunocompromised, who are asking fellow Ohioans to be considerate as we navigate this next phase of the pandemic.
She joins us live tonight. Emily, they're still going to be playing it safe.
Yeah, Rob, I spoke to several immunocompromised people this evening. Now, they all have different circumstances, but they all say that all they can ask for is that people would continue to be considerate of people who are highly susceptible to the virus, whether you can tell by their physical appearance or not. Wednesday, June 2nd, has been circled on the calendars of many Ohioans for weeks.
Being vaccinated, you kind of think, okay, this is the end. But then on the other hand, feeling a little apprehensive.
As state health mandates expire, including the order requiring facial coverings.
It seems like as soon as Governor DeWine said that we were going to take the masks off today, tomorrow, everybody at the stores, there's like half of the store didn't have them on already.
And while some are celebrating,
not go full out, but take it one day at a time and just to get out and enjoy the sunshine.
Those with compromised immune systems are experiencing heightened anxiety.
We do still have to be cautious. Like, I know personally, I'll still go into a store and wear a mask just to be safe and have that, second blanket of security.
Andy Velitis is a college student living with cystic fibrosis and says she's taken extra health precautions nearly all her life.
We're not doing it to make a statement or whatever, but we are truly trying to protect ourselves or a loved one.
Dawn Moore has cared for her teenage son through several recovery periods.
I probably would still wear a mask and, all the hygiene stuff.
Following 3 open heart surgeries and a valve replacement.
I worry that if Devin gets it, it could be so much worse.
She fears the end of statewide mandates may cause another surge of COVID-19 cases. Dr. Keith Armitage of University Hospital says people with significant immunosuppression are not always fully protected by the vaccine, but says there is cause for optimism.
Vaccinated immunosuppressed people, they can still get the virus. But thankfully, we're not seeing people get critically ill. There still seems to be some protection, even though it doesn't prevent them completely from getting COVID.
Karen Jones cares for her mother living with Alzheimer's disease, and while she's apprehensive about the lifting of the mandates, she fears the lack of socialization during the pandemic may have been equally detrimental to her mother as the threat of the virus.
I have seen a decline in my mother just because she hasn't been out and about like we were in the past.
Rob, one mandate will remain in place, though, and that is Health Director Stephanie McLeod's order requiring schools to report COVID-19 cases to their local health departments. Reporting live in Cleveland, Emily Hamilton, News 5.